Hey, Dr. Frank from IDN. Just another clinically relevant segment for you, and this one's a little bit different. We're going to be looking at needling mechanism at the cellular level. So I will make it clinically relevant, I promise, so hang in there with me. This came out of an article that is an acupuncture article, and really they looked at a number of different things, but they focused on macrophages and the effects that needling has on their proliferation. So when we look at what does needling really do, and in our courses we talk about a number of different things, and I think the standard things are it increases vasodilation, vasoconstriction, that balance, right? It works on pain, analgesia. It has reduction in muscle shortening and stress. And it also has effects certainly on the central nervous system. But the area that I want to focus on for this particular little spiel here is the releasing of anti-inflammatory cytokines. Now, what is a cytokine is the first thing, right? So you put a needle in the body, a cytokine is released. It's a small secreted protein that has interactions and has communication with a number of other cells, making things happen, right? So one of those things is it facilitates the macrophages, right? And a macrophage is a monocyte. It's part of the immune system. It comes in and it really engulfs and digests pathogens and debris and nasty things that we have in our body. So I kind of remember that from an M1 standpoint, like an M1 tank. It comes in and just kind of cleans house, right? And as a result of that, it's pro-inflammatory. So it creates inflammation, which is a good thing, right? We need inflammation at this particular stage of healing. Now, the other things that the cytokines do and the needling mechanism does is it actually facilitates the M2 macrophages. Now, they are anti-inflammatory, right? So they actually promote the release of anti-inflammatory factors to reduce inflammation, and they also work towards improving tissue damage or stimulating tissue repair and remodeling. So it's a 1-2 punch in regards to how those guys work together. Now, why is this relevant to us, that needle? Is because our therapeutic goal is to obtain taking pathological inflammation and making it physiological inflammation. So when you have M1s coming in and creating a pro-inflammatory environment, right, you don't want the inflammation to be too big, too red, too hot, too long. So you want to use needling to come in and balance the M1-M2 ratio, because the more of the M2s start to facilitate, you start to get that anti-inflammatory effect, which actually reduces or prevents an immune system overreaction. Right? And we see that in our clinics when we're needling in and around inflammation, how wonderfully it drops down. So there's a number of reasons why that particular thing happens, but this is one of them in regards to balancing these macrophages from M1s to M2, which is an important anti-inflammatory action of needling, particularly in immune disorders. So just another thought process, a deeper dive into looking at why dry needling is so important as a tool for us in our clinical practice, and certainly something that our patients benefit from. Thanks.